Welcome to Roadmap to Residency Evidence-Based Application. In this video, we will be talking about epidemiological principles. So epidemiology is a study of the distribution of disease frequency in human population and the determinants of that distribution. Epidemiologists are not concerned with an individual's disease as clinicians do, but with the population distribution of the disease. Distribution of disease by person, place, and time. Assumption: disease does not occur randomly and disease has identifiable causes which can be altered and therefore prevent disease from developing. This is what uh, epidemiologists are concerned about. So the definition of epidemiology is the study of distribution and determinants of health-related states or events in a specified population and the application of this study to control of health problems. The determinants can be physical, biological, social, cultural, and behavioral factors that influence health. Health-related stress or events can be there. For example, health status, diseases, death, other implication of disease such as disability, residual dysfunction, complication, recurrence, but also causes of death, behavior, provision, and use of health services. Now, what are the aims of epidemiological research? Okay, we describe the health status of a population, to assess the public health importance of diseases, to describe the natural history of disease. Now, this all comes under descriptive epidemiology, where we are describing the thing. Then we need to explain the etiology of the disease, to predict the disease occurrence, and to evaluate the prevention and control of the disease. Now, here in point number 4, 5, and 6, we are doing analysis. So this is called as analytical epidemiology. And by applying all this knowledge, we control the disease distribution, and this is called as applied epidemiology. So what are the descriptive and analytical epidemiology? So descriptive epidemiology describes the occurrence of disease, for example, cross-sectional studies. And analytical epidemiology is, for example, observational studies like cohort, case control, cross-sectional or ecological studies, where the researcher observes the association between the exposure and the disease, estimates and tests it. Experimental analytical epidemiology, for example, randomized control trials, where the researcher assigns intervention or treatment and estimates and tests its effect on the health outcome. Now, these are the different epidemiological study designs. So, did the investigator assign exposures? Yes, then that is called as experimental study. If not, then that is called as observational study. So, in observational studies, is there a comparison group available? Yes, then that is called as analytical study. If not, then that is called as descriptive study. And if there is comparison group available and it is an analytical study, then in what direction we are going to do the study? For example, if we are going from present to past. For example, if we are starting with an outcome and we are tracing the exposure, okay, or if we are going through exposure and we are tracing the outcome. Now, the first one, where the exposure and outcome is called as cohort study, and the case control study is when we have a case and we trace the exposure, whether the case had exposure or not. Now, but if we are tracing exposure and outcome at the same time, that is called as cross-sectional study. Now, if the investigator has assigned exposures, then that is called as experimental study. And if there is a random allocation, that is called as randomized control trial. If not, that is called as non-randomized control trial. Now, I cannot emphasize you enough that how much important this slide is. So if you understand this slide, then half of the public health sciences is over. And you may get at least one question from this slide. So again, exposure towards outcome is cohort study. Outcome towards exposure is case control study. And both exposure and outcome are at the same time at a slice that is called as cross-sectional study. Now, study design and its strength of evidence. So the strength of evidence is highest for systematic review and meta-analysis, and it is lowest for case report and case series. Okay. Now, if we report one case, that is called as case report. If we report, for example, 5 cases, that is called as case series. And there is cross-sectional study, case control study, cohort study, randomized control trials, and systematic review and meta-analysis. Now, these are the different sort of observational studies. For example, case series, we describe several individual patients with the same diagnosis, treatment, or outcome. Example, description of clinical findings and symptoms has no comparison group, thus cannot show risk factor association with the disease. Cross-sectional study is when we show the frequency of disease and frequency of risk-related factors which are assessed in the present. For example, what is happening right now, and it measures the prevalence of the disease. Very, very important. Case control study is when we retrospectively compare a group of people with disease to a group of people without disease. It looks to see if odds of prior exposure or risk factor differ by disease state, and it is asking what had happened. And we use case control study to calculate the odds ratio, the odds of happening the disease. For example, patients with COPD had higher odds of a smoking history than those without COPD. Talking about cohort study, it compares a group with a given exposure or risk factor to a group without such exposure. It looks to see if exposure or risk factor is associated with later development of disease. It measures the disease incidence, and it is used to calculate the relative risk. Now, which disease is more important to public health? Okay, how we how we how we determine that? Okay, for example, we calculate it via attack rate. So attack rate is the number of ill persons, that is new cases, by population at risk exposed. If the attack rate is very high, then that is a disease of public health significance. Now, how are cases transmitted? Or what are the different types of cases? So the index case is the first case that is identified. Okay. Primary case is the case that brings the infection into a population. Secondary case is infected by a primary case, and tertiary case which is infected by a secondary case. Now, this is how we describe a case. Now, what is the timeline of infectious diseases? So, first of all, in suspected population, there is dynamics of infectiousness, and then in that susceptible population, there is infection. Now, when infection happens, there is a latent period, there is an infectious period, and when that infectious period ends, when the patient is treated, there is a non-infectious period. What are the measures of disease frequency? So first of all, there is cumulative incidence or incidence risk IRR, whatever you really. So incidence, just remember that incidence is the number of new cases over a period of time. Okay, the number of new cases, and prevalence is the number of new plus old cases at a point of time. Okay, for example, the number of present cases that are here on April 10th, 2025. Okay, now that is called as prevalence of the disease at that date. We can see number of new cases by number of people at risk by number of existing cases by total number of people in a population, right? Now this is a definition of incidence and prevalence, and this is very important. Now, the difference between endemic versus epidemic is that endemic is when there are a significant number of cases throughout the year. Okay, now it is endemic or it is prevalent for that population. And epidemic is that whenever a new case or whenever the new or same case, it peaks out more than the normal prevalence rate. Okay, for example, there are 100 to 150 cases happening throughout the year. Okay, and but in the month of December, they will actually spike to 1,000 cases. Now that has turned into an epidemic. Now, it may be the same case, the endemic changing to epidemic, or it may be a new agent like COVID-19. Now, what are the levels of disease occurrence? Sporadic level, endemic level, hyperendemic level, epidemic or outbreak, and pandemic. Now, sporadic level is when there are occasional cases occurring at irregular intervals. Endemic level is when there is persistent occurrence with a low to moderate level. Hyperendemic level when there is persistently high level of occurrence. Epidemic or outbreak when the occurrence clearly in excess of the expected level for a given time period. And pandemic is when the epidemic has spread over several countries or continents like COVID-19. Now, what are the factors influencing disease transmission? So there are three important factors: agent, host, and environment. So agent like infectivity of the pathogenicity, the virulence, the immunogenicity, the antigenic stability, and the survival rate of that agent, of that pathogen. Environment, for example, weather, housing, geography, air quality, and food. And host, that is the patient, age, sex, genotype, behavioral status, nutritional status, and health status. Does the patient have any significant comorbidities? So what is the cause and model of risk factors for a coronary vascular disease? Okay. Now this is just an example. For example, there are some environmental factors like socioeconomic status or work environment, or there may be some behavioral and genetic factors, so family history, cigarette, diet, or exercise. Now these all gets superimposed upon the biological risk factors. For example, if the patient is having hypertension or increased blood um, lipid level, or is the patient having homocystinuria. Now, it is all will cause significant morbidity and mortality, for example, stroke and MI. Thank you for watching. Keep studying.